So I became an acupuncturist because, like a lot of other acupuncturists, I had the experience of seeking out treatment. And I found that the help that it gave me totally changed the quality of my life in a really dramatic way. And I was so moved and inspired by that experience that I wanted to learn the medicine and share it with other people and hopefully help them find similar kinds of change in their life. One thing that I've found, as you know, once I started studying the medicine and practicing it and talking to people about it, is that a lot of people just don't know that much about Chinese medicine and what it can do for them. Even oftentimes patients who come in for treatment, you know, they'll be coming in and we'll talk about their reason for coming, which might be back pain or insomnia or whatever it might be. And then I'll ask them if there's anything else that they'd like to address with treatment. And very often, you know, they're kind of like, oh, well, I don't know. I don't really know what else acupuncture is good for. Like, what else could we do? So it's great to have the chance to be here and share the information with some people, especially because I think in these times that we're living in right now, Chinese medicine really has a lot to offer. And it can be a great way to support and take care of ourselves through these really challenging times. With that in mind, my goal for today is that you walk away learning, you know, with a kind of a basic understanding of what I mean when I'm talking about Chinese medicine and acupuncture, in terms of what, sort of a little bit about what our approach to health and healing is, and also what sorts of conditions and issues it might be able to help you with. If there's time, we can get into a little bit about, you know, what treatment might look like if you were to, you know, start seeing someone, what you could expect from that. And also we can talk about what's happening right now with COVID going on and how people are handling that in their clinics and their practices. So I guess before we get started, it would be helpful, I don't know if we're going to do it by a poll or we could just do a show of hands. I'm curious if anyone here has ever had acupuncture before, just so I have a sense of who's, oh great, so good, a handful of you have, terrific. Well, hopefully you had good experiences and you're here to learn some more about it. Okay, so I guess I should start by saying, you know, sometimes you'll hear the term Chinese medicine and acupuncture used interchangeably. I'm already doing it and we'll probably do it throughout the talk. So Chinese medicine, just to give you a little bit of an kind of framework, is sort of, you could think of it as like an umbrella. It's a whole system of medicine and there are different modalities and ways of treating that fall under it. And acupuncture is generally the one that people here in the US are most familiar with. And so that's often the term that we default to, just because that way people know what we're talking about. Chinese medicine also includes herbal medicine, and it includes some different like hands-on body work type therapies. It includes Qigong and Tai Chi. I know there are some Tai Chi classes I saw on the schedule here at the center, which is really cool. It's a great practice that can help support your health generally, and it's good for a wide range of people. So I would definitely recommend checking that out if you haven't. And so anyway, that's just sort of a little terminology, I guess, just so that I'm not saying Chinese medicine and you don't really know what I'm talking about when I say that. So in Chinese medicine, we look at the body through a different lens than Western biomedicine does. And that's partly why I think Chinese medicine is a really great complement to Western medicine. And it's really good at handling a lot of conditions where Western medicine tends to struggle. So it's really good with chronic and ongoing issues that, you know, don't resolve quickly or easily. It's good with mental and emotional issues, things like anxiety and depression and other, you know, emotional struggles. It's great as a preventive medicine, and it's really good with the things that Western medicine, you know, conditions where there's not really a clear answer in Western medicine, and, you know, people bounce around from specialist to specialist, and or they just, you know, they get tests run, and there's just never really a conclusive explanation for what's happening and a clear path of treatment. And because we're looking at things differently than Western medicine does, oftentimes in those situations, acupuncturists are able to see a connection and see a pattern that's there and understand and have a way of approaching it. And that actually was part of my experience. As a teenager, I had gotten mono and got really sick. And over the course of a couple of years, I kept having these bouts of like really extreme fatigue that were dubbed, mono relapses, though they didn't really know exactly what was happening. And then for, a good 15 years after that, I never really felt like I got better fully. And I was exhausted all the time, and I would sleep, it didn't matter how much I slept. I never had all the energy that I wanted and or needed. And, every few years they would run a bunch of blood tests and test my thyroid levels and look for Lyme's disease and send me for a sleep study. And there was just never really an answer. And then I started going for acupuncture and taking herbs regularly. And, there was a very clear pattern that I fit into that Chinese medicine was able to identify right away and treat. And within a few months, I really started to turn a corner, and my energy improved dramatically. I wasn't getting sick nearly as often. I was just much more resilient. I was able, even if I did something that really taxed my energy, I was kind of able to bounce back. And that wasn't even actually the main reason that I had first gone for treatment. That was just sort of a side bonus that totally improved my quality of life really dramatically. And so I mentioned that just as an example of, when there's something that there's not a clear answer for, sometimes Chinese medicine can be helpful. And that's often how people end up coming to us, is that they've tried everything that's out there that they know of, and they've seen all the doctors and they're not getting better. And so then they're like, well, I'll give acupuncture a try. I've heard maybe it can help. So that's one way to think about it. And it's also really great for just all sorts of everyday issues. And I'll talk a little bit more about that later. So another important thing to say about Chinese medicine is that it's really what we would call a holistic medicine. And so we're looking at the person as a whole integrated entity. And so rather than compartmentalizing and looking at your eyes and looking at your heart and looking at your lungs and kind of breaking it all up, we're looking more at the person in their totality and how everything in your system is working and relating to each other. Chinese medicine recognizes relationships that Western medicine doesn't, between different parts of the body and different systems in the body. And so we're really kind of looking at the whole picture. And that includes not just the physical body, because, we're not just a physical being. We also are emotional and mental beings, and we're energetic, and we, are interacting with the environment around us and people around us and sensing things and responding to that. And so Chinese medicine recognizes that all of those dimensions are an important part of health and well-being, and that they're all interconnected. We can't separate out the mind from the body. They influence each other and have a relationship. And so that's something else, kind of a little bit of background about how we look at things. I'm going to be talking today more or less from the perspective of 5-element acupuncture, which is a certain tradition within Chinese medicine, because it developed over many thousands of years and across a vast area that covers, much of Eastern Asia. There are different traditions and schools of thought that developed over time. And then as acupuncture and Chinese medicine was brought to the US and Europe, in the 20th century, it was brought by different people from different areas. And so there are certain perspectives that we all share, and then there are little nuances and differences in the way that we might look at a case and understand it and approach treatment, or in the needle techniques that we might use. That's not really terribly important for you to keep track of unless you're interested in knowing more about it. But I just mention it because I'm talking from the way that I practice and treat and think about things, which if you were to go seek out acupuncture after today, or if you've had it before, you might find that your experience could be a little bit different from what I'm describing. And so I just want to mention that so that you're prepared for that. Okay, there we go. All right, so I'm starting here because I think this is a really important foundational idea within Chinese medicine, which is that our bodies already know how to heal, and they're really good at it. And that's, maintaining health and homeostasis and proper functioning is what our bodies are meant to do, and what they're skilled at doing, and what they're doing all the time. And the emphasis in our healthcare system, and kind of in our culture more broadly, is often to focus on what's wrong. And so we focus on where there's pain and where things aren't working properly, what the problems are. And this can kind of set us up to be at odds with our bodies. And we want the pain to go away, we want the anxiety to go away, because it's an unpleasant experience and it's interfering with our day-to-day. And so in a way, like, we can almost become, we become at odds. Our body and our illness can become like an enemy that and it's easy to forget that actually my body's doing an incredible job all the time of right now I'm talking to you and sharing information and thinking about, a bunch of different things that I want to say. And meanwhile, everything's just working and keeping me okay. And, and healing that cut on my foot, and all of this just goes on without us needing to do anything in particular. And so in Chinese medicine, the orientation is a little different, in that any of these symptoms or illnesses that we're experiencing are essentially, they're like messages from the body. And it's a sign that something's going wrong and isn't functioning properly. And so we want not only to address what's, alleviate whatever the issue is, and, help the pain go away, or help you feel better, but we also want to understand why that's happening and what's going on underneath, that symptom that you're experiencing as the really acute thing, or the illness or the disease that you have. Everything is, any kind of disease or symptom is a process. It's not like you don't wake up one day, with a tumor, right? There's a process that's been happening over time that has led to the point where that develops. And so what we want to do is we want to be able to see and understand what that underlying process is and address that too, because until we address that, then the situation isn't really fully resolved. And we call this treating the root and treating the branch. So it's like the symptoms you can think of are like the branches of a tree. And they're not just floating out there in the middle of the air, unattached to anything. They're stemming off of something deeper that's often kind of under the surface and not immediately obvious to the naked eye. And so what we do as acupuncturists is we look to identify what that is, and then figure out where things have gone wrong and what your body needs in order to get back to its natural state of being able to heal and take care of itself. And we use acupuncture points and herbs to do that and to help restore the proper functioning in the body. And I'm using the word body a lot right now. And so I just want to point out that, as I said before, Chinese medicine, it's a holistic medicine. And so it recognizes the interconnection of physical and mental and emotional well-being. And so even when I'm saying body, I'm talking about the whole system. So this could easily be, we could be talking about physical pain, but we could also be talking about emotional pain or stress or things like that. And disease in the view of Chinese medicine, disease can originate at any one of these layers. And so we can kind of treat at any layer. And not only can it originate, something could originate on the emotional level, but end up with physical symptoms. And so there's a relationship there. And one of the reasons that I think acupuncture and 5-element acupuncture in particular is so effective is because it can really address any one of these levels wherever healing needs to happen. And it's able to touch us on any of these levels too. I think a lot of us have probably had the experience, certainly a lot of people have in recent months, of, maybe physically our bodies are okay, but having physical health does not necessarily mean that everything is well and good, right? And that there are other challenges and struggles that we could be having. And so having a medicine that's able to see all of that and understand the relationship between it, and work with someone kind of wherever they are on whatever level they need is I think really helpful. and a big part of why Chinese medicine spoke to me. Okay, so this is a picture here of, oh, did I just, can you guys still, I didn't mean to exit that. I was just trying to check on the time. Oh, okay, here we go. Okay, so this is a picture of the 5 elements, and you can ignore all the arrows for now, but I just bring it up because it's going to kind of be relevant to some of what I'm saying. But so, yeah, so I guess to get back to the point I was making, in terms of beyond the physical health, some of the things that we can look at, sometimes right now, for instance, a lot of people, there's a lot to worry about, right? And it can be easy, we can get stuck in worry, where our mind is just, kind of circling round and around and around and around on the same thoughts and the same worries, and we can kind of get stuck in that. Or it's easy to be, we can get sort of paralyzed in fear and not knowing what's coming, right? There's a tremendous amount of uncertainty right now about how things are going to go and how we should best handle it. And that all has to do with the water element, which is that blue circle down in the bottom here. And so the water has a lot to do with the unknown and facing the unknown and the fear that arises in that. And each of these elements have emotions associated with them. But to talk a little bit about water, because I think it's something that's relevant for a lot of people right now. So water's job is, when there's potential danger or when there's something unknown coming, it puts us on alert, right? And it makes us vigilant about what's happening. And that's a really good, healthy response, right? Because then we can look around, we can, figure out what's happening. What do I need to pay attention to? How do I need to prepare for this? But sometimes we can end up getting sort of stuck in that fear and vigilance and awareness, and we're not able to drop down out of it. And it starts to consume too much of our energy, and it gets in the way of, we can't really feel anything other than alertness and vigilance. And so we're unable to rest and sleep well and relax. We're not able to feel joy or connect with people and have the full breadth of our experiences, or of what's possible for our experiences. When we get stuck in an emotion like that, it can start to affect us physically. So maybe we get stomach aches or headaches, or lose our appetite, or different things like that. It can put us on edge in our relationships and start to affect that dimension of our life. And so, fortunately, each of these elements, in addition to having one of these emotions, it also gives us lots of strengths and skills and tools to work with for facing the unknown. So water, for instance, is also, it gives us that alertness so that we can be ready, and we can prepare, and we can figure out what we need in order to move forward safely. Water reminds us that we have it connects us with our resources, right? And everything that we have available to us externally, but also internally, right? We've all, I'm sure, been through experiences in life where, there's some sort of challenge. There's something that seems unbearable or overwhelming, and we all come out the other side, right? Like we have what it takes to get through what we face and what we need to do. And that strength and that willpower to do it all come out of the water element. And so it's kind of, it's like a relationship that has what it needs to meet the challenges that it presents. And we could do this within any one of the elements where there's that dynamic. And so the really cool thing about acupuncture is that we have a whole bunch of acupuncture points and herbs that can help us tap into these qualities and remind us when we forget, when we're overwhelmed by the situation and don't know what to do or how to face it in a way that feels okay. Acupuncture points can help reconnect us with that like deeper sense of assurance that we have, and remind us that we have what we need in order to face the circumstances. And so that's sort of one of the a little bit of like the heart of the 5-element system and some of the deeper ways in which it can work with people. And it's because of this relationship that I really feel that acupuncture and Chinese medicine are able to help us with almost any challenges that we face in life. You know, they can provide support. And it doesn't need to be, you know, existential fear in the face of a pandemic. There are lots of other things that that acupuncture and Chinese medicine are really wonderful for too. As I may have already said, it's a complete system of medicine. And so it's really designed to treat pretty much anything that could be going wrong. If you're having an emergency situation, if, you know, you're in an accident or there's bleeding or a heart attack, or, you know, the ER is the best place to be, of course. That's really where Western medicine excels and where it has a lot to offer and can give you the best care possible. Particularly, you know, in life-threatening types of situations. But really anything outside of that, I think that Chinese medicine offers a lot of support for and can be really good. And as I said before, particularly with like chronic and ongoing conditions and things that aren't easily resolved, or where, you know, there isn't a good treatment option in Western medicine, or the treatment option is, you know, drugs or surgery that you're not really, you don't want to go down that path. I think acupuncture is typically worth a try, or at least certainly worth a conversation with someone. You know, most any acupuncturist, I think, would be willing to talk to you about whatever it is that you have questions about and what you're concerned about, and answer them and help you figure out whether or not acupuncture could be the right choice for you. So more specifically, some of the things, I mean, in this moment, some of the things that I think a lot of us are treating, stress, anxiety, depression, strengthening immunity is an area where Chinese medicine can be really strong. Insomnia is a great one. Other things that we often treat, pain is a big one. That's often what people know acupuncture for and what they'll first seek it out for. And that's mostly because some of the early studies that were done on acupuncture were related to pain. And so it was one of the first things that Western medicine started to acknowledge and accept acupuncture as effective for. And so that's sort of the thing that most people know about it. It's great with all sorts of digestive issues. Chronic headaches are really good. Anything in the category of sort of female and gynecological health, from, you know, issues with menstruation and infertility up through menopause and helping in that transition. It can be a great support for people. And similarly, on the side of men's health, it's great with prostate issues or difficulties with sexual function, things like that. So it runs the gamut, and it's great, I think, with recovery from illness or surgery. Anything where you're trying to rebuild or regain function or need healing to happen, acupuncture and herbs can really help move that process along. So here's a list, a really big list, of just some of the conditions that acupuncture is often used for. This list came from the World Health Organization, and back in the 90s, actually, they did, in the late 90s and early 2000s, they did a survey of all the clinical trials that had been done with acupuncture and looked for where there was evidence that acupuncture was effective, and published this list. And so I'm sure we could update it now, because I'm sure there have been more clinical trials done. The research side of things isn't an area where I've focused a lot, but this just gives you a sense, and this isn't even the whole list because you wouldn't have been able to read any of it if I had put it all on here, but there's about 100 conditions and diseases and symptoms that they have identified and said, like, we have clear scientific evidence that acupuncture is effective in helping with these conditions. You know, and as you can see, it ranges the gamut. And so that's sort of a quick overview of some of the things that it can help with. I brought, ducking off the screen here. I brought some acupuncture needles with me because I thought it might be useful to see my next slide. So you can see here, this is an image. One of the questions people often have is, you know, does it hurt? Or I don't like needles, I'm afraid of needles. Like, don't think acupuncture is for me. So this is a picture of me needling someone, and you can see I'm holding in my hand there, and in between my fingers is the handle of the needle, and then the really thin bit of metal that you can actually barely see below the handle is going into this patient's arm. And so these needles are really different than what you would see at when you go for a shot or to have blood drawn at the doctor. It's not a hypodermic needle. It's a really thin stainless steel needle. I have one here. I don't think you're even going to be able to see it. Put it against my skin. And so they're generally the thickness of a few hairs. They're flexible and they're solid stainless steel. They're sterile and single use. So it's never been used on anyone. It's not going to get reused. It's really safe and sterile and clean in that way. And I thought that maybe I would just stop my screen share here and just show you an example of what it's like to get needled. So I'm going to redirect my screen down so you can see my arm, hopefully. Oops. I'm going to ungracefully do this with one hand. So this little plastic thing I have here is called a guide tube. Some acupuncturists use it, some don't. I typically don't, but because I'm using one hand, I need to, because I can't stabilize the needle with my other hand. And what it does is it just, holds the needle in place so that you can needle with one hand. And so there, you can see, is the needle. And I actually didn't really feel that at all. Some points are more sensitive than others. Sometimes, typically, there are two sensations you might feel. The initial, when the needle goes into the skin, there might be a little bit of a pinch, or you might not feel anything at all. And then as the needle connects with the acupuncture point, there's often a sensation, and that can be, commonly it's like a dull, achy feeling that lasts for a few seconds. Sometimes it can be a little bit sharper, or it could feel like a tingling or a heat. Some people notice like movement around the area. Sometimes people don't really feel much at all. So there can be a wide range. Generally, it's not very painful, and it doesn't last for more than a few seconds. Overall, people typically find the experience to be really relaxing. It's not uncommon for patients to fall asleep or to kind of get up off the table afterwards and feeling like they've just been in a really deeply relaxing place. So I would say rarely is kind of the sensation involved with it something that's really unpleasant or problematic for people. You might notice, I'm just going to lift this up. So there will be we've used different needling styles. So sometimes the needle will go in and just kind of stay in there for 10 to 20 minutes like this. Sometimes people will manipulate the needle. So they'll thrust it up and down or turn it around a bunch. That's often when they're looking if there's a lot of pain in an area and they're looking to release trigger points. That's one method that gets used. The tradition I practice is we typically just do this, or we go the needle just goes in and right back out and doesn't stay in the skin. We generally use really gentle needling techniques. And I'm trying to think if there's anything else to say about that, but that's, I just kind of wanted to give you a sample in case you hadn't seen it before, and let you know that it's not too scary and terrible. And let's see, what else should I say? So I guess I mentioned herbs is another common area that or a common tool that we use in Chinese medicine. Herbs are really great as adjunctive therapy to acupuncture, in my opinion. We can treat pretty much anything that we would treat with acupuncture. We can also address with herbs. And typically using herbal medicine helps it makes progress quicker and more effective. It makes the treatments more effective and progress move along more quickly, I would say. And herbs can also be used on their own. And historically, I mean, herbal medicine was actually the heart of Chinese medicine before acupuncture was. And so it's a really long and well-developed history. And it could be a good tool for some people right now because you can do it remotely, right? Some people don't want to be or can't be going out and going to an acupuncturist office, but there are some of us who have been doing remote herbal appointments. And so using telehealth, we can have a conversation find out what you want to address, and prescribe that way. And then herbs can be taken, and we would do regular check-ins to see how it's going and make adjustments as needed. If that is something you're interested in, you would have to go see a licensed acupuncturist or herbalist. Chinese herbs are a little bit different than Western herbs, where you can sometimes buy them over the counter or at Whole Foods or wherever. It's a more, I guess, a more complex system of herbalism, and because of that, you need to be trained and licensed in order to be able to buy and prescribe the herbs. So it would, and of course you always want to be working with someone and talking to your doctor or your trained healthcare professional before you take any herbs, especially if you're on any kind of medications. There are sometimes interactions, and so that's always something we want to be careful about and look out for. There are a few other modalities. Where are we? We're doing okay on time. So there are a few other things. Let me find my slides. Oh, wait, can you guys see this? No.
We see you.
You see me. Okay.
Yes.
Sorry. I've never done the screen share. I've never presented on Zoom before.
You're doing great.
Okay. Playful current split. But I can't do. All right, sorry. Gotta do it this way. Okay.
There we go.
There we go. So here are some of the other modalities that you might commonly encounter. Moxibustion comes from an herb. It comes from the mugwort plant, and basically it gets dried and processed down, and we make these little cones that you can see there. What that is it's a little like compressed cone that then gets lit with an incense stick, and we burn it until you feel warmth in the acupuncture point. So that's something that some of us do. Cupping and gua sha are more physical manipulation therapies. Cupping you might have encountered in the last Olympics, Summer Olympics. It gained some notoriety because Michael Phelps had all these big circular marks on his back and his arms, and people were wondering what was going on. And he was getting cupping, which basically, there are different types. These are glass cups here in this picture, and you create suction with it, and then put it on the skin, and it like suctions onto your skin. And what that does is it helps in areas where there's pain or limited mobility or a lot of tightness. It brings circulation of blood and of qi energy into the area, and it helps loosen up the fascia and the soft tissue, and it can relieve that pain and stiffness in certain cases. And so, and gua sha is another way of essentially achieving the same thing. And in that case, oil is applied to the skin, and then we apply pressure using a tool and kind of work over the area and help bring circulation and movement and break up stagnant tissue there. Tui Na is a type of massage that is doing something very similar. Diet and lifestyle is one of the big pillars of Chinese medicine, and is viewed as, really central and important. And so it's not uncommon that I'll work with my patients about their diet and lifestyle and make recommendations there and things that I think might support their goals with treatment. I mentioned Qigong and Tai Chi before. That's another one of the classical pillars of Chinese medicine. And I haven't been to the class here, but it's great that you guys have it, and I'm interested to check it out sometime maybe. And then we have herbs, which I already talked about. This is a picture here of some raw or bulk herbs, we call. So these are just, plant parts that have been dried. And sometimes we prescribe herbs in that format, and people get them and you simmer them on the stovetop, but you can also get them as a pill or a little granule that you dissolve in water and drink as a tea. And so there are different ways of working with that depending upon what works for people. And so then COVID is something I should just address quickly, since it's a really important part of our lives right now. So in order to become an acupuncturist, infection control is part of our training. We have a national organization that manages the training and testing for that. And that's something we all have to go through before we can even get licensed and start treating. And so when COVID hit, that organization put together a list of protocols that, as far as I know, pretty much all acupuncture practices are following. And they're all based upon CDC guidelines. And so the types of things that practices are doing, I mean, number one is stepped up infection control and disinfection. So most people have spaced out patient appointments so that there's ample time in between to clean and disinfect all the surfaces. In my practice and all the others that I know of, everyone is required to wear masks. So obviously we all know the importance of masks right now. I'm using a filter, an air filtration system as well to help, that helps to capture and destroy any virus particles in the air. So using that as an added safety feature. Social distancing is an important part of what we're all doing. So people are generally spacing, as I said, spacing out appointments so that patients aren't passing each other in the halls. Waiting rooms are closed, and typically, people are asked to wait in their cars. For instance, I have people text or call me when they arrive, and then I'll go and meet them at the door and walk them in so that they don't have to touch any surfaces. We're screening, just like I got screened when I came into the center here. And, so asking questions, taking temperatures, things like that, making sure to limit exposure. And then the other thing that some people are doing is telehealth. And obviously you can't get acupuncture needles via telehealth, but we can work with herbs, we can work with diet and lifestyle advice. And actually a cool thing that I've learned about since the pandemic is something called acupuncture magnets, which I have a couple of here. And so what it is it's a little adhesive, kind of like a Band-Aid. And then on the other side, there's a little disc. It happens to be a magnet, which I imagine is part of what it helps, but it's got a little like bump on it. And so you can apply these to acupuncture points, and it's like acupressure. And basically is stimulating the point that way without a needle. And you don't even need magnets. You can also just use, some people are doing acupuncture or acupressure prescriptions for their patients. So, they'll talk and find out what's going on, and then teach them how to locate certain points on their body and apply pressure to them, which I know you guys had here at the center a session with that a couple months ago.
Amy?
Yes.
Yes, you still have the screen up.
Oh,
with
you can't see
pictures. I'd like to see what the magnets look like.
Thank you. Yeah.
Yes,
so
thank you.
Here is one side. This is like the adhesive side, which is like a Band-Aid essentially. And then on the other side, there's this little magnet disc. And I've been using them actually to treat myself because I didn't learn about these in school. And it was a colleague of mine who taught me about them once the pandemic started. And so I've been playing around with them. And I mean, my experience is that if I use these, I feel pretty much the same as I do when I get a needle treatment, which is pretty great. I mean, it's great for treating yourself when you can't get to treatment, for me, but I mean, it's a great tool, I think, in this time when people, want to be remote or it's not uncommon, like I said, for people to be really uncomfortable with needles. And so I think that I'm excited to work with these as a way for people who don't like needles, as an alternative way for them to be able to get some of the benefits from the medicine. So I'm just looking at the time, and I think we're right about there. And I sort of touched on all the things I wanted to address. And so I think let's open it up for questions and see what else is out there.
Sounds great.
Okay.
Thank you, by the way, for demystifying the needle. I got a little jumpy in the tummy. I always do when I see needles.
I didn't think about that. I should have.
No. You were just boldly going there, and I think it's really helpful because if you never, acupuncture needle, you're right. You see the big needle. Anyway, I see some folks have unmuted themselves. Dolores, did you want to share?
Yes, I would. I've had a lot of acupuncture. My body responds well to acupuncture. And I would like to know where you're located. So if you can give us share that information, it would be great. Thank you.
Yeah, sure. Is that okay, Carolyn?
Sure. You want to just give us your email address? I can type it in the chat. Or
I have it. Actually, I have. So here's my. Oh no, you can't see it. Sorry. Okay, here's my contact information. I'm located downtown, and I've got an office there with parking, which is a great bonus. And here is my email address and my phone number if you would like to be in touch with me and find out more. And I should say to that end, I mean, for me or any other acupuncturist, you know, I think most people would be happy to talk to you if you had questions about whatever is bothering you, and now or at any point in the future, and you wanted to know if, you know, Chinese medicine might help, or you just want to talk to a practitioner and get a sense of if whether or not they're a good fit for you. You know, some of us do, like I do, free consultations if people have questions, and I think even folks who don't do that officially would be happy to, you know, spend a little bit of time talking with you and answering questions. So
great. I put that in the chat as well. So
great. Thanks, Karen.
Yeah, sure. Let's see. Anybody else want to?
Yeah, I do. I have
Sure.
several questions. The slide that you showed on cupping and what was the other?
Gua sha, it's called.
Gua sha. Is that the same thing as acupressure then?
It's not, no. I actually didn't bring my gua sha tool with me, but it's, we use different tools. They're sometimes made out of jade, or you can use, actually, you know, like a Chinese soup spoon. Sometimes people use the edge of a Chinese soup spoon, and basically, like what you would be doing, I'll use my pen and pretend that was, you know.
And Jamie, do you want to stop sharing your screen? That's
yeah.
okay. It's called life on the
I can see myself in the box.
There you go.
So what you would do is, you know, let's say this was the area I was working on and this was my tool, and we basically just rub it along and apply pressure. And what'll happen is sometimes the area will turn red, and actually like dark red or purple spots will start to come up to the surface. And that usually means that there's some kind of stagnation there and that there's not good circulation in the area. And by applying that pressure and working over it, we're bringing circulation back to the area, which can help release. It's largely used for pain, when there's pain in an area that has some typically musculoskeletal component to it.
So in your practice, are you running a HEPA filter the whole time, or do you have just a special mask that you mentioned for the...
Yeah, I'm wearing a mask, and I'm having my patients wear a mask, and I'm running a filter 24 hours a day in the office. Yeah.
And then the magnets that you showed, magnets have been around for a long time.
Yeah.
And was that originally Chinese there, or you said something that you didn't learn about it?
Yeah,
or,
I don't know, to be honest. I don't know. Yeah, we didn't learn about them in my school. A friend of mine used to get them a lot because she got acupuncture as a kid. It was her primary health care. And so that was what they used more than needles. And so she was telling me about them. And so a lot of what I know has just been from talking to other practitioners and experimenting with them on myself to see how they work before I've started using them with patients. Right. But I don't know. It's on my list to try to find out more of the history of it, but I don't have a good source for that at the moment.
Only because, I mean, I know that it's been over 20 years.
Oh yeah, they're not new.
Yeah,
they're just new to me.
I've used them, so
great.
And they've got the magnet bracelets and that sort of thing. And then I think my last question is, you didn't go into the other 4 elements.
I didn't.
Do we have time for you to just highlight those?
How many questions do we have, Karen? That's kind of a whole nother talk, which is why I didn't go into them.
Right.
There's one that I thought was relevant at the moment.
There's 2 more questions in the chat, but you know, maybe if it's, I know it would be a desecration, but even 15 seconds on each one would be helpful. Do you know?
Yeah, sure. So from water, and so another thing that's interesting to know about the elements is they're each associated with the season. So actually, if you think about different seasons of the year, that can give you a flavor for each of the elements. So water is associated with winter. From winter, we move into spring, which is the wood element. And wood element is, among other things, about it's about planning and vision and goals. It's the wood. I think one of the best ways to like summarize the wood energy is if you think about a seed. right? And there's a seed that's in the dirt at the beginning of the spring, and it wants to grow and be a plant, right? It's got this potential to become a plant. And like, what does it take? It's got to break through the shell of the seed, and it's got to move its way through the dirt and grow. And it's all the time moving up and forward towards the light. And like, whatever is in its way, there can be a concrete sidewalk in its way, right? And it finds a way to break through and keep growing. And so that's kind of the wood energy that drives us and gets us, helps us see where we want to go and get there. The fire element is associated with summer. We're in fire season right now. It's, if you know anything about yin and yang, it's the most yang of the elements. So it's really movement and outwardness. But in terms of the more emotional sides of it, fire is about connection. It's about relationships. It's another one that's taking a real hit right now, as a lot of us are much more isolated than we're used to. And it enables the emotion associated with fire is joy. And so being able to like move into those like happy, light, bright times is all part of the fire element. The earth element is kind of viewed as the transition between each of the elements. We tend to associate it with late summer, which is the transition from summer into fall, because that time encapsulates a lot of what's to do with earth, which it's the harvest, it's abundance, earth is a lot about community and like that kind of connection. Fire is a little bit more about like one-on-one interactions, whereas earth is about a community and a whole, and how we're all relating to each other and giving and taking and supporting each other. And earth is also associated with the digestive system. And so it's about everything that we take in, not, food we take in and have to digest, but also all of our life experience and thoughts and information and whatever we're taking in and digesting and processing and making a part of us in another way. And then the last one is the metal element, which is the time of year of fall or autumn. And the metal element is, so if you think we're kind of going through the life cycle of a plant, right? And so the fall is the time when things start to die back, the leaves fall off the tree. And metal is sort of about, it's really about like what's essential and like the dropping away of everything else and reconnecting with what's really essential and what we need to hold on to in order to move forward. Mm-hmm. The emotion associated with it is grief, because there is a kind of loss of things and death that's associated with metal, but it's like the upside of grief is that it helps us clarify what's important to us and what we really value. So metal has a lot to do with what we value and what's of worth. I think I have them all right.
Oh, that's good.
Yeah, you're welcome.
Thank you very much.
So there's two questions in the chat. Okay. One is acupuncture used to treat osteoporosis successfully?
That I actually don't know. I'm not aware of any studies. It certainly would be good in earlier stages. It's great, as I think I may have mentioned, as a preventive medicine in a lot of cases. But I don't actually concretely know about cases with osteoporosis, and it's not something I've ever treated. But I can look into that, and if you have the contact information of the person who asked, I'd be happy to share anything that I learn.
Okay. The other question, thank you, is acupuncture known to cure, hypnotremia, consistent low sodium?
Oh, that's another one I don't know. That's probably more specific than they've ever run any trials on, would be my guess. I mean, I can say, so it helps regulate other, it's good at regulating, it has been proven to be effective with regulating blood sugar and particularly early stages of diabetes before someone's insulin dependent, and regulating levels of other fluids and substances in the body. So I would think that it might be able to, but I cannot definitively say whether or not there's any science backing that up. And again, I don't have direct experience with that one. Ooh, we've got
just
another
had
storm
some
happening here.
thunder here. So
Yeah.
I appreciate your honesty and clarity on that. I think getting back to, I know for me with acupuncture, I was like, I have this pain. Are you going to help me with it? And something that I found, first of all, frustrating, but also, and then, oh, this is nice, is that holistic view. It's like, if I come in with a sore throat, they're not going to stick needles in my throat.
Yeah.
Do you know, it's about the whole body. Where is the energy blocked? And sometimes that could be my big toe, you know, that actually helps my sore throat. So it's not, I have found it to be, it's just personal experience, very intuitive, more like, that's why I have an Apple and a Mac. It's instead of a PC, I find it more psychically intuitive. I don't know. So sometimes these particular ailments, like I liked your example about having mono and how that was sort of a side effect that was wonderful that got cleared up. It takes some readjusting of the mind, of the Western mind, I think, to really even try it.
Yeah, it's a totally different way of thinking and approaching things, and sometimes it's not easy to translate it directly into our Western brains, and I think that's part of where the trouble comes. You know, Western science is really interested in like what it can see and feel and measure and touch, and a lot of how acupuncture is work. You know, we're working with the chi and the energy body in a lot of ways, and so that's not as easy to, you know, put a finger on or measure with a tool, and so it's part of why it's hard to you know, it grew up out of a whole different worldview than we have in the modern Western world, and so it can be a difficult translation, but oftentimes people give it a try and have success, and that is how they end up becoming interested and converted to the theory behind it. So great. Well, I see people dropping off, so thank you all for tuning in, and I hope it was helpful, and I hope Chinese medicine offers something to you if ever you need it.
Thank you very much.
Yeah.
Thank you. Thank you for coming. Stay dry and safe.
Yeah.